Here is some of high-yield questions and answers for common systemic or tropical diseases that affect the eyes. 1. Measles. What is the ocular manifestation of measles? Answer. Early signs include conjunctivitis, photophobia, and Koplik spots small, which is a white lesions on the buccal mucosa. Late complications include corneal ulcers and blindness due to viral keratitis. What are the complications of measles affecting the eyes? Answer. Measles can lead to corneal scarring, keratitis, and blindness, especially in immunocompromised individuals. 2. Vitamin A deficiency. How does vitamin A deficiency affect the eyes? Answer. Vitamin A deficiency can lead to night blindness, dry eyes, which is xerophthalmia, Biddett spots, which is a keratinized patches on the conjunctiva, corneal ulcers, and eventually blindness if untreated. What is the pathophysiology of night blindness in vitamin A deficiency? Answer. Vitamin A is essential for the production of rhodopsin, a pigment in the retina that allows vision in low light. Deficiency impairs the function of rods, causing night blindness. 3. Trachoma. What is trachoma, and how does it affect the eyes? Answer. Trachoma is a chronic infectious disease caused by Chlamydia trachomatis. It leads to follicular conjunctivitis, pannus formation, which is neovascularization of the cornea, and eventually, corneal scarring and blindness. What is the leading cause of preventable blindness in the world? Answer. Trachoma is the leading infectious cause of blindness globally. What are the key stages of trachoma progression? Answer. Stages include active infection, scarring of the conjunctiva, trichiasis, which is abnormal eyelash growth, and corneal opacity leading to blindness. 4. Leprosy. How does leprosy affect the eyes? Answer. Leprosy can cause lagophthalmos, which is inability to close the eyelids completely, dry eyes, corneal ulcers, and blindness due to nerve damage and secondary infections. What is the primary mechanism behind ocular involvement in leprosy? Answer. Nerve damage, particularly to the facial nerve, which lead to loss of blink reflex, and damage to the corneal sensation can result in ocular dryness, injury, and subsequent infection. 5. Onchocerciasis, same as river blindness. What is onchocerciasis, and how does it affect the eyes? Answer. Onchocerciasis is caused by Onchocerca volvulus, a filarial worm. It can lead to severe ocular manifestations, including keratitis, uveitis, cataracts, and eventual blindness due to inflammation from microfilariae in the eye. What is the characteristic ocular manifestation of onchocerciasis? Answer. The hallmark ocular manifestation is sclerosing keratitis, which can lead to permanent scarring and blindness if untreated. 6. Diabetes mellitus. How does diabetes mellitus affect the eyes? Answer. Diabetic retinopathy is the most common eye complication, leading to vision loss. It is characterized by microangiopathy, retinal hemorrhages, exudates, and neovascularization. Diabetic macular edema can also occur. What is the pathophysiology of diabetic retinopathy? Answer. Chronic hyperglycemia leads to damage of the retinal vasculature, causing leakage, hemorrhage, and retinal ischemia. This can result in neovascularization and macular edema. How is diabetic retinopathy classified? Answer. It is classified into non-proliferative, which is early stage with microaneurysms and hemorrhages, and proliferative, which is advanced stage with neovascularization and risk of retinal detachment. 7. Thyroid diseases. How does hyperthyroidism affect the eyes? Answer. Graves' disease, which is the most common cause of hyperthyroidism, can lead to thyroid eye disease, characterized by exophthalmos, lid lag, conjunctival injection, and in severe cases, optic nerve compression and vision loss. What is the mechanism behind thyroid eye disease? Answer. Autoimmune inflammation of the retroorbital tissues, leading to swelling of the muscles around the eye and increased volume in the orbit. How does hypothyroidism affect the eyes? Answer. Hypothyroidism can cause dry eyes, corneal edema, and ptosis. 8. Sickle cell disease. How does sickle cell disease affect the eyes? Answer. Sickle cell disease can lead to retinopathy, particularly in children and young adults. It is characterized by vessel tortuosity, retinal infarcts, hemorrhages, and neovascularization. What is the pathophysiology of sickle cell retinopathy? Answer. Vascular occlusion in the retina due to sickled red blood cells leads to ischemia and subsequent neovascularization. What are the signs of sickle cell retinopathy? Answer. The most common signs include salmon patch hemorrhages, black sunburst lesions, and neovascularization in advanced stages. General considerations for tropical ocular diseases. What are the common risk factors for ocular involvement in tropical diseases? Answer. Poor hygiene, malnutrition, exposure to contaminated environments, lack of access to healthcare, and living in areas endemic to certain diseases e.g. onchocerciasis, trachoma. How can tropical ocular diseases be prevented? Answer. Vaccination for measles, improving hygiene, provision of vitamin A supplementation, mass drug administration, and surgical interventions for conditions like trachoma and cataracts. Thanks for watching this high-yield Q&A session. I hope you learned something new today. Don't forget to like and subscribe.